Hello everybody, I'm Jay. I'm a nursing student at Mercy College of Ohio, and this is my take one of me videotaping my first video on physical assessment. So I can review myself, and it might could help you guys if I decide to share this video. Alright, so I'm going to go ahead and start going through it. Hello, Mr. Smith. Alright, I'm washing my hands. Alright, my name's Jonathan. You can call me Jay. I'm a student nurse at Mercy College of Ohio. And can you tell me what your name and date of birth is, please? Alright, John Smith, December 31st, 1995. Alright, thank you, Mr. Smith. I'm just checking your identifier, making sure that's alright. Alright, I'm going to go ahead and provide privacy by closing the door or pulling the curtain around me, depending on which. So, I am here to perform a physical assessment on you and take some vital signs. This will give me a baseline data and will help me to go ahead and see if all your values and everything are alright. You can assist me with this by just laying down, and during the process I'll give you some cues to make sure that you can help me in any way that you can. Do you have any questions for me? Is that alright for you? Okay, well, I'm going to go ahead and start the assessment if that's alright with you. Alright, the first thing that I'm going to assess is the nutritional status. So, can you tell me what your current height and weight is, Mr. Smith? Right, current height is 5'7", and your weight, you say, is 150 pounds. Alright, thank you, Mr. Smith. Do you have any recent weight loss or weight gain? No? Do you have any nausea or vomiting? Alright. Do you have any heartburn? Do you have any problems chewing or swallowing? Do you take any dietary supplements? Alright, thank you, Mr. Smith. And after that, I'm going to go ahead and ask for a brief medical history. So, Mr. Smith, have you had anything to eat, drink, have you smoked, or exercised within the past 30 minutes? He says he didn't. Do you have a history of a mastectomy? Nope. Do you have an AV fistula or a dialysis shunt? He says he doesn't. And is there an arm that I should not take blood pressure on? And he says there's not. Right, so first thing I'm going to do is go ahead and get my thermometer. I'm going to treat this like it was the COVID, so I'm not going to do any of the face thing, but I would take the thermometer probe, put it in the posterior sublingual pocket, so under the tongue, support it, and take the temperature. Normal range of temperature is 96.8 degrees Fahrenheit to 100.4 degrees Fahrenheit. And that's also 36 degrees Celsius to 38 degrees Celsius. Alright, so now TP, so next I'm going to take the pulse rate. Okay, Mr. Smith, I'm going to go ahead and time myself for 30 seconds. And I'm going to go ahead and take the pulse rate. Checking the radial pulse. Starting now. Alright, so I counted 38 beats per minute, which is 38 beats for in half a minute, which is going to be 3, 3, 6, 8, 8, 16, which would be 76 beats per minute. It was a normal rhythm, regular rhythm, and that is within the normal range, which is for pulse, which is 60 to 100 beats per minute. For respirations, I got 13 breaths in half a minute, So I'd multiply that by 2, which is 26 breaths per minute, which is above the normal range of 12 to 20 breaths per minute, so I document that that was abnormal. It's taken at the same time while palpating the radial pulse, so the rhythm was regular, and radial pulse that I got was about a 2+. Alright, Mr. Smith, so now I'm going to go ahead and take your blood oxygen reading. I'm going to go ahead and take the pulse oximeter. Right, make sure it's turned on. Find the fingernail. I'm going to put this on your finger, okay, Mr. Smith? Is that alright for you? Right. So let get a reading. Get a reading for cover up Mr. Smith here. Alright, I let it sit for about 15 seconds to make sure you got a good reading. Right, and that for that reading that was about 97 blood oxygen, which is within the normal range for blood oxygen, which is between 95% and 100%. And do you take any supplementary oxygen, Mr. Smith? Nope, and he's not hooked up to any oxygen, so I'm going to say that he's on room oxygen, and I would check to see what the flow rate for supplementary oxygen was if he was on that type of oxygen. Right, next I'm going to go ahead and take blood pressure. Okay, Mr. Smith, since you told me in your brief medical history that you don't have a preference, do you have a preference of which arm? No, is this one alright? Your right arm? Alright, good. So first thing I'm going to do is measure 40%. 40% around, it's more than 40% around, but so I need a smaller cuff, but since this is just we're going to pretend he has meat on him. Right, so left, this is going to be his right, and then I'm going to find the bladder, measure 80% around. It's more than 80%. Right arm, palpate the brachial. Okay. Right, do you have any idea what your normal range for blood pressure is, Mr. Smith? No? Alright, so now I'm going to either palpate the brachial or the radial. I tend to do the radial, so I'm going to find the systolic blood pressure. Alright, so systolic is around 140. Alright, so I'm going to add 30 to that, 40, 50, 60, which is going to be 160 for the systolic pressure, is what I'm going to pump it up to. Alright, going to palpate the brachial. Alright, Mr. Smith, I'm going to go ahead and take your blood pressure. Alright, 132 over 86. Thank you, Mr. Smith. Which is the normal range for blood pressure is between, well, is about 180 over, that is not correct, 120 over 80. Alright, thank you, Mr. Smith. I'm going to go ahead and put this away. Alright, Mr. Smith, do you have any pain right now? He says that he is experiencing a little pain. Can you tell me where that pain is, Mr. Smith? In your right arm. Okay, so I'll go ahead and pay attention to that during my physical assessment. Alright, so now I'm going to do PQRST. So what provokes your pain? Does moving it around hurt, and does it kind of hurt when it's just staying there? Alright, so he says it kind of hurts when he moves it around, and it's kind of prominent when he just lays there. Q is quality, so how would you describe your pain, Mr. Smith? Right, kind of sharp when you move it and just dull when it's laying there. Right, QR is radiates. Does it radiate down your arm? Do you feel it anywhere else besides your arm? Nope, it doesn't radiate. Alright. S is severity. So on a scale of 1 to 10, how would you rate your pain, Mr. Smith? Right, he would rate it a 7. Alright, Mr. Smith. So PQRST. And when did this start happening? This started happening last week. Alright, has it been off and on since then, or has it just been a constant thing? Says it's been constant. Alright, thank you, Mr. Smith. And is it tolerable or intolerable? Right, he says it's tolerable. So now I'm going to go ahead and go into my physical assessment portion. So I know he's alert. I've been having a conversation with him. Alright, Mr. Smith, can you tell me what your full name is, please? Right, John Smith. Can you tell me who the current president of the United States is? He says Donald Trump, which is correct. And now, do you know where you are currently? He says he's in the hospital. I was like, that's good. Do you know why you're at the hospital? He says he's at the hospital because he slipped and fell last week and hurt his arm. So that's why he's here. And so he's alert and oriented ×4. And his demeanor is calm and collected. And he's not showing any signs of agitation right now or disturbances. Right, so now after alert and oriented, I'm going to go ahead and I would check, but now since this is kind of COVID, I'm going to look at the hair. I would check the hair, see the thickness, see if there's any sign of alopecia, check the moisture, see if there's any abnormalities in the scalp. After that, I would go ahead and move down to the eyes. Well, before that, assess facial symmetry. Right, face looks symmetrical. After that, I'm going to go ahead and assess the eyes. I'm going to go ahead and check. Alright, pupils are bilaterally round, same size, about 7 millimeters. Right, they look the same. Right, and I'm going to go ahead and shine this light in your eyes, okay, Mr. Smith? Right. Alright, so he is responsive to both direct and indirect light. Both pupils constrict, and he has, forgot what's called for a second. 1 second. It's called consent. So it's consensual. And can you look at my pen light again, Mr. Smith? Right into your nose. Alright, so accommodation. His eyes converge. And now I'm going to check the sclera color. The sclera color is white. Can you pull, and I would ask him to pull down his eyelids so I could check his conjunctiva and make sure that there's no sign of drainage. So now after that, I'm going to go ahead and assess the face as a whole, and I would feel the temperature. I'd say it's warm. The face is looking pretty white right now. He looks really pale, and his face seems intact. Here, I don't see any skin breakage, and some freckles, and there's some acne vulgaris. And then after that, I'm going to go ahead and move down to the nose. Right, Mr. Smith, so I'm going to shine this in your nose. Right, I don't see any nasal flaring, I don't see a deviated septum or any drainage. The color of the nose is uniform with the face, pretty white. Looks like he's missing his nose, but that's alright. So, uniform with the rest of the face. Now I'm going to move down to the ears. Alright, ears are symmetrical. Ears are a little bit redder than the rest of the body, so that's good, but it's not cherry red, so it's just a light pink. And I'm going to check for drainage. I don't see any drainage in the ear. Then I'm going to go ahead and check for hearing aids. I don't see any hearing aids. Do you have any hearing aids, Mr. Smith? He says he doesn't. Alright, so now there's going to be a mask on, and same thing for the nose. I would just say what I'd look for the nose. I want to actually check because there would be a mask on, face shield. But I would ask him to open his mouth, check to see if tongue's midline, check to see if he can smile, to see if his face droops on either side, make sure it doesn't, check the integrity of the teeth, see if he has dentures, check the moisture and color of the lips, the mucous membranes, the tongue, the back of the throat, and everywhere in the buccal cavity. Right, and can you say hungry, hungry hippopotamus, Mr. Smith? Alright, he said it back to me, so his speech is clear, and he's been talking to me, so I know his speech is clear. And now I'm going to go ahead and move down to the neck. Right, so first I'm going to go to 45 degrees. Alright, I'm going to check for JVD and NVD, Mr. Smith. 45 degrees. I don't see any JVD at 40 or NVD at 45 degrees. Going to raise the head of the bed to 90 degrees. Raise the head all the way to 90 degrees. And then I check for JVD again. Nope. It says for aortic pulsations. aortic pulsations are visibly bilaterally. So I'll make sure to document that to check that for later as well. Now I'm going to go ahead and assess the carotid. If I said aortic, I meant carotid pulsations, not aortic pulsations. Carotid pulsations. Now I'm going to take the carotid pulse. Alright, that's a 2+. I'm going to grade it. I'm going to do it one at a time because I don't want him to pass out. Alright, and that's a 2+ on the left side too, so 2+ bilaterally. And now I'm going to go ahead, make sure the trachea is midline, feel the trachea, make sure it's down, and now I'm going to go ahead and check for bruit with the bell of my stethoscope. Alright, Mr. Smith, if you can lift your neck up, please. Alright, thank you, Mr. Smith. I do not hear any bruit. So now, after that, I'm going to go ahead and move on to the chest. Alright, Mr. Smith, is it alright if I pull down the covers and inspect your chest? Alright, thank you. Okay, Mr. Smith, let's see. Right, so the skin is uniform with the rest of his shoulders and the rest of his face. It's a little bit whiter because it doesn't get as much sun, but I don't see any skin breakage. I'm going to go ahead and feel. Right, I don't feel any abnormalities, any masses, and the skin is intact. I don't see any breakage in the integrity of the skin, and I'm gonna feel it's dry. The skin is dry. I don't feel any too much excessive oil or anything, and there's no hair in the chest, so it says hair distribution. And so now I'm gonna go ahead and locate the cardiac points. All right, Mr. Smith, I'm gonna touch your chest. Okay. Right. So this is the sternoclavicular notch. I'm going to go down, that's the manubrium. I'm going to go find down, okay, right there. That is going to be the angle of Louis. Go down, second intercostal space right of the sternal border is the aortic. Second intercostal space left of the sternal border is going to be the pulmonic. Rib down, third intercostal space left of the sternal border is going to be Erb's point. Rib down, fourth intercostal space left of the sternal border is going to be the tricuspid, rib down, fifth intercostal space left of the sternal border mid-clavicular is going to be the apical or the mitral. So now I'm going to go ahead and listen to those points. I'll still take those points. Now I'm going to listen for 60 seconds, and I like to palpate the radial artery at the same time. Go listen for 1 minute. Stop. Alright. So I got 84 beats per minute, so I know from starting the assessment his heart rate has raised a little bit, and I assessed the apical and radial pulse. There's no apical radial pulse deficit. S1 and S2 is noted for the heart sounds, and the rate was regular. Right? One thing I did forget to do when I did the eyes, self-correction, when I did the eyes, I would also palpate the sinuses for tenderness. I would palpate for periorbital edema, and I'd palpate the temporal arteries and grade them. Right, Mr. Smith, thank you for letting me listen to your heart. Now I'm going to go ahead and listen to your lung sounds, okay? So I'm going to have you sit up, please, and take a deep breath in through your mouth. I'll cue you for the first few times, but I don't want you to get out of breath and hyperventilate, so you can just go ahead after the first few times and just breathe at your own pattern, okay? Make sure you're breathing in through your mouth, please. Gonna go ahead and locate the quadrants and the breath sounds, not the quadrants, the locations of the breath sounds. So the bronchial is gonna be up here at the neck, then like right to the side of the claviculars, is gonna be the bronchial vesicular, then the outside is gonna be the vesicular, kind of in a C shape. Right, now I'm gonna go ahead and listen. 8 in the front, 10 in the back. Alright, can you go ahead and take a deep breath in for me, Mr. Smith? And out. Thank you. In and out. Alright, can you go ahead and lift your arm for me, please, Mr. Smith? Thank you. Looking for lateral lung sounds. Your other one, please. Alright, can you go ahead and sit up for me, Mr. Smith? Now I'm going to do 10 in the back. Avoid the scapula, because I don't want to listen to them. And kind of go out as I go down around the scapula. Alright, thank you so much, Mr. Smith. Let me get you straightened up there, please. Oh god, your head's coming apart. That's not good. Alright, thank you, Mr. Smith. Alright, so, breath sounds, no adventitious breath sounds such as wheezing or crackling, and the depth of the breaths were moderate. There was no labored breathing, no adventitious breath sounds, no use of accessory muscles, and they were irregular. So, now I'm going to go ahead and move down from the chest down to the abdomen. Alright, so when was the last time you peed, Mr. Smith? And I pulled the gown down over him. When was the last time you peed, Mr. Smith? Alright, 2 hours ago. Alright, was there any burning sensation when you urined, or any pain? No. Was there blood in your urine? He said that there wasn't. Did you have a sense of urgency or hesitancy when you went? No. About how many times do you urinate in a day? About 3 to 4 times. Okay, thank you, Mr. Smith. And what was it? What color was it? Light yellow. Was it clear? Alright, he said it was clear. Alright, so now I'm going to go ahead and look at the abdomen. Pull down, look at the abdomen, inspect it. Alright, without palpating. I don't see any masses. He doesn't have any tattoos or piercings. I don't see any surgical incisions. And the color is uniform to the upper chest, and I don't see the integrity of the skin is good, and I'm not going to palpate or anything yet. So, right, when was the last time you had a bowel movement, Mr. Smith? Right, he said he pooped time yesterday. Alright, was it hard to pass, or was it easy to pass? Okay, good. Any blood in that? No. Alright, so when was the last time about how frequently do you poop? Alright, about twice a day? Okay, so you haven't pooped at all today? Alright, since it's the evening, that's kind of something we might want to check on. Do you have any sense of bloating? Nope. He says he doesn't. Do you have any flatus? I'm going to assess for that, which is gas. Have you been passing gas? He says yes, he's been passing gas, which is a sign that he might be pooping. Right, now before I palpate, I'm going to auscultate all 4 quadrants, starting in the lower right quadrant, excuse me. Alright, so active times 4 quadrants, heard bowel movements in all 4 of the quadrants, and Yep, so now I'm going to go ahead and palpate the quadrants. Do you have any pain in your abdomen, Mr. Smith? He said no, he doesn't. Alright. And if he did, I'd palpate that quadrant last. Right, now I'm going to go ahead and feel all over. Right, firm. And while I was looking at the abdomen, self-correction, when I was looking at the abdomen, I would go ahead and note the contour of the abdomen, see if it was flat, if it was round. Now I'm going to feel it's soft. I don't feel any tenderness. Does that feel tender, Mr. Smith? No. Checking for bladder distension. Don't feel any bladder distension. Alright. Does any of that hurt, Mr. Smith? Nope. He says it's good. The temperature is warm. The moisture is dry. I don't feel any dryness. I don't feel any moisture. And also self-correction, when I was inspecting the abdomen, I look for aortic pulsations right above the navel. Alright, are you okay, Mr. Smith? Now we're going to go ahead. If you could put your arms above the covers, please. Thank you, Mr. Smith. Alright, now I'm going to pull this up. Here, I just pull his gown down, but for the sake of this. Alright, I'm going to go ahead and look at your upper extremities, Mr. Smith. Right? Check for pressure ulcers. Anything like that. Don't see any pressure ulcers. Okay. I'm going to check for skin tutor, so I'm going to see if there's any tenting. And I like to check on both arms. Right, no tenting, it's elastic. I'm going to go ahead and check the nail bed. Right, capillary nails are intact. The fingernails are intact. The the nail beds are pinkish colored. Now I'm going to check capillary refill. Capillary refill is brisk bilaterally. Alright, Mr. Smith, I'm going to go ahead and palpate your radial arteries at the same time. Alright, equal bilaterally, 2 plus bilaterally, and regular rhythm for what I can tell. Brachial. They're equal, regular rhythm for what I'm feeling right now. They're about a 2 plus as well. Alright, Mr. Smith, can you go ahead and grip my fingers, please, as tight as you can? Thank you. Alright, so that's strong and equal bilaterally. Can you go ahead and push up against my hands, Mr. Smith? Right, can you push down? Can you push out? Alright. And now can you lift your arms all the way up? All the way down, to the side, back, right, full range of motion. Also another self-correction when I did the neck, I'd also be checking for the range of motion of the neck, so up, down, side to side. Right, so when I assess that, strong bilaterally in both arms, equally strong. Alright, so now I'm going to go ahead, get my little cotton tip applicator. Alright, Mr. Smith, this is dull, this is no, it's vice versa. This is dull, this is sharp. Can you go ahead and close your eyes for me, Mr. Smith? Thank you. What's this and where is it? Right, that's right, that's dull and lower. Dull. Is that sharp? Yep. Sharp, awesome, great. Do you have any numbness or tingling, Mr. Smith, in your arms? He says no, he doesn't. Right, now I'm going to go ahead and move on to the lower extremities. Alright, Mr. Smith, so I'd have the gown all the way down on him, and then just pull this off to reveal his bony legs. Alright, Mr. Smith, so I'd verbalize how to palpate the femoral arteries. I'd go down in the inguinal area, find it bilaterally, and grade those. Right, now I'm just going to go ahead and look at the legs. I don't see any redness, I don't see any swelling. Now I'm going to go ahead and palpate. Alright, I don't see any tattoos or any varicosities. I'm going to go ahead and palpate, look around, don't see any pressure ulcers. Does any of this hurt, Mr. Smith? Alright, let me know if you feel any pain. Alright. Alright. Don't feel any tenderness, and everywhere, I forgot to state that everywhere, but I'd be checking for edema. I'm not sure why I'm forgetting so much, but this is why I'm practicing in front of the camera. I check for edema everywhere, and I'd grade pitting edema by looking at it, pressing down, and when we had the foam models, we kind of saw what grade all the way up to 4, how to grade each of those. So I'm checking for any edema in the legs. don't feel any edema, and do you feel like and that's swelling? So he doesn't have any swelling in his legs. His skin is warm to the touch. It's dry. There's no wetness. It's warm. So now I'm gonna go ahead and check for the popliteal pulse, one at a time. Right, I'd say that's about 2+. Now I'm gonna check the other one. That's 2+ regular rhythm bilaterally. Now I'm going to find the posterior tibialis pulse bilaterally. Right, that's about 2+ bilaterally. Now I'm going to find the dorsalis pedis pulse. And that's about a 1+ bilaterally. So, alright, did that. Now I'm going to go ahead and inspect the nail beds, inspect the feet, make sure they're all good. The nails are intact, don't see any breakage. Nail beds are pink. I'm gonna go ahead and cap refill. Cap refill is brisk bilaterally. So now do that. I'm gonna go ahead and check for the reflux. Can you push up against my arms, Mr. Smith? I mean my hands, Mr. Smith? Right, here. Can you push up against my hands? Thank you. Down. Right, can you move your legs up, your knees up to your chest? Right, can you move them down? Can you move them to the side and back? Alright, full range of motion in the legs and bilaterally strong muscle tone, and same thing for the arms. Check the muscle tone. Muscle tone is good and strong bilaterally. Same thing with the legs. Muscle tone is good and strong bilaterally, and good strong. Now I'm going to check for DVT, so deep vein thromboses or thromboses, however that is. Alright, so I don't see any redness or swelling in the legs. Do you have any pain in your legs, Mr. Smith? He says he doesn't have any pain in his legs. Alright, I check for edema if it was present. Any redness, gonna feel warmth. They don't feel overly warm or cold to me. So that looks good to me. Alright, thank you, Mr. Smith. Go ahead, cover you back up, Mr. Smith. If you need anything, please let me know. Here's your call bell. Gonna make sure the bed's low, locked. Right, I'm gonna go ahead and wash my hands and document my findings. So, sorry guys, that's kind of like a rough draft of, hopefully I was filming that entire time, but that was kind of just a rough draft of my, assessment. This is my first time doing this assessment on video. Hopefully you guys find that, so I'm gonna be filming more of these so I can kind of grade myself, but just let me know if you find these helpful, if you want me to make more of them, because I know sometimes the skills video that they upload can be a little confusing. So, I'm not an expert or anything, this is just me doing my nursing school stuff. So, don't quote me on an expert or anything, but it's just nice to see someone else doing it. Alright, thanks guys.